Hello, welcome to It's Rafael Gutierrez, and today I'm going to talk about how in self-defense sometimes people talk about using bites. I'm going to talk about benefits and disadvantages of it, and it really did come out of a discussion I had with a gentleman named John Titchen. I actually have all his books. Uh, they're great if you're thinking of teaching martial arts or if you've been teaching it. A lot of times they're actually worthwhile because they do sometimes give you a different way to look at stuff. Sometimes I've noticed that his books actually show the same thing that I'm actually looking at. And for me, it's actually kind of nice to have both because sometimes, a lot of times, having a opposite point of view really does help pretty much evolve your own art. Now, before I actually mention that, I did want to talk about certain books, and one of them I really love, an author that I really love, is Murakami. If you've never read a Murakami novel, I recommend reading one. One most people tell you to start with is the Kafka on the Shore. I really enjoy it. It does have some things that are a little different. Some people may not enjoy it as much as I do. It does have the magical reality aspect of it, but it also has a lot of things that a lot of philosophy involved in it. Now I can't remember which book it was, but I remember one of his quotes from. I can't remember again. I can't remember the book. It was jealousy is a prison, which you put yourself in, or something to that point. And I actually started thinking about it the other day. I have noticed that certain things have happened in different people's lives. And one of the things that actually I remembered was when my little brother bought himself a house, he had friends who lived around him who lived in the same condominiums that he actually owned. And when he decided to buy his house, there were actually some of his friends that got really upset with him, saying that he was pretending not to have anything when in fact he had money. And the truth is, he actually told them, it's like, I wasn't pretending. What I'm doing is I tell people I like to save money so I can buy what I really need. Now, a lot of times people will tell you, oh, well, I can't afford to do one thing or another. A lot of times, for those who are in martial arts, some people tell you, oh, I can't afford to go to Okinawa because, well, it's expensive. Yes, Okinawa is expensive. Here from California, I've gotten tickets. I've seen the tickets range anywhere from $2,000 all the way, actually from a coach. I myself have gotten it for as cheap as $700 round trip. I've seen some that actually have gone up to 2,000, and it varies on time, how much time you have available, and how long you want your trip to go. One of my trips actually took me from Los Angeles. I live in San Diego, so I had to drive up to Los Angeles. I went to Shanghai, and then from Shanghai, Okinawa, and it was actually one of the cheapest tickets I ended up buying. Now, if you, yes, $500 is a lot of money, but the thing is, you have a choice on what you do. If you think about it, if you save $3 a day for 1 year, you have over $1,000. And so that's one thing that people actually forget is yes, you can really quickly save money to do what's important to you. The thing is, it has to be important to you because if not, you're not going to make a sacrifice. I have talked about a lot how a lot of people want to do something supposedly, but they don't want to do it enough to sacrifice anything else. And it is something to actually look at. Now, like I said, and that's actually what I learned from my brother. Actually, my younger brother, has taught me a lot on how to save money and how different retirement accounts work so you can get to retirement at an early age. A lot of people don't pay attention to this, and what they do is, well, I need money, I want to do this, I need a vacation, uh, and that's a choice. People don't think about it, but it is a choice. If you want to go to Okinawa, that's a choice. You're going to have to sacrifice something for it, and that's one of the big things that people forget is, everything is a weighing something out. If you see someone who's seems like they're struggling, and then they do a big trip, well, the reason they're struggling is so they can do that big trip. You might be jealous of them doing that big trip, but what kept you from pretty much saving money and doing that? And that's one of the things to actually think about is, there's a lot of different ways to do stuff, a lot of different ways to get around stuff. I work at San Diego City College, and I've had a lot of students who have told me that they want to go to Japan and how they're actually planning their life to get there. Now, one of the things that happens is, and that's my girlfriend singing in the shower. One of the things that does happen is a lot of the reason I mention these kids is a lot of these kids don't necessarily have a lot of disposable income. And so they're doing different things. One of them is studying and doing everything he can to be able to work in Japan as a English teacher. I have other people who have actually tried other things, and you know, it really is an interesting thing when you start seeing what people sacrifice for what they really want. Now, about bites. I want you to think about this. If you actually look here and feel your face, you'll actually feel that there's an arch of bone coming across here. That arch is called the zygomatic arch. And if you were to actually have a skull in front of you, for instance, if I were to have my skull, I would be able to put my 2 fingers through that arch without any much of a problem. What that means is one of the muscles that comes from the temporal fossa here goes under the bone and goes to the mandible here that pulls up is about the strength of my 2, is about as wide as my 2 fingers and about as thick as them. And you think about that, it actually is over here coming this entire area, almost the size of my palm. So you have a muscle shaped almost like my hand going in there that's pulling up there. Right away you notice that there's a lot of force that can be developed there, but that's not the only thing. You have the same muscle on the other side, so you have 2 muscles pulling up. You then have one on the zygomatic arch here, which comes to it's called the angle of the mandible here. Now, if you go to the side here, you'll notice your teeth, and you'll notice that there's bone right around here, and then there's a bump where the muscle is. That's actually called your maxilla. Again, you can see that that muscle is really thick. Again, probably about the size, mine probably about the same thickness as 2 of my fingers, about the same length, so it's actually coming this way. And again, another muscle that helps bring stuff up. Already you have muscles that are probably actually about the size of some of the most of the muscles of the forearm. Now, let's take the other muscles inside. You actually have 2 which share a similar name. You have the lateral medial pterygoids, which also help bring the jaw up, slide it forward, and do all the different movements that you can in your jaw. There's more muscles beyond that, but we'll just stick with those. What I'm showing you is you have a lot of muscles with a lot of force. If you actually feel the muscles of the pretty much the masseter and the temporalis, you can see that these are actually hard and strong muscles. How hard and strong, you might ask? Well, if you ever do any CPR classes, a lot of times they tell you if you're worried that someone's choking, you can go into their mouth, but do not use your finger, because if they wake up, they can break down, and you can actually lose a finger. So we're talking about something that actually does have enough money to break small bones. On top of that, there's another thing that happens, and that is your teeth. Your teeth are really the strongest bones in your body. They actually have a lot of different variations. They have a lot of different chemicals in them, which make them a lot more dense than anything else. And these are going to allow you to bite down hard. Now, in a self-defense scenario, if you find yourself in a position where you can bite down and take a chunk out of someone, well, go for it. Maybe. I won't say yes or no. But what I will say is, if you were to do it, I guess I should say, you could take off a big chunk of human flesh off your attacker. What this means is it's going to be real easy to identify this person, because they will need an emergency room visit to replace whatever you bit off. But there are problems with this. Now, first we're going to talk about, I'm not going to talk about liability, because if you do bite someone and you take a chunk of flesh off, you probably will end up getting sued. On top of that, there's a lot of different things that can happen. The human mouth carries a lot of bacteria, and biting into someone can actually spread that bacteria into your attacker. And so you can end up introducing bacteria into someone's bloodstream and end up, pretty much getting them extremely sick, or even potentially having a death. So if you're okay with living like that, well, that's one thing. If you can actually get to someone and bite them. But there are problems with this. First is, let's say you know the person that you're with, who's attacking you. The first question I would ask is, do you know if they have any bloodborne diseases? Now, I'm going to tell you something that every clinician, anyone who works in hospital, always does. When they deal with any human being, they just assume that they are carrying every disease known to man. That's how they approach it. The reason is it's safer that way. You don't want to catch whatever someone may or may not have. And so that is one of the important things. Now, if you're biting someone, you're actually exposing yourself to blood. Now, what would most clinicians and people working in a clinic do? They wear gloves. They wear actually protective equipment. If you're biting into someone, you can actually, and especially if they're moving, you can actually tear areas in your mouth, which will introduce their blood into yours. Now, you might say, well, that's no big deal. What are the chances? Well, the truth is, like I said, if you actually talk to clinicians, it's big enough that they would tell you you do not want to touch someone's blood unless you have to, and if you do, use protective equipment. So that's one of the big things that ends up happening. You can expose yourself to other diseases. Now that's a balancing act you have to do yourself. The other problem with this is, just like you can break and tear and take a chunk off of someone, when you're biting, if someone actually pushes in, you can end up actually getting your teeth to be knocked out. Now, if you lose a tooth, well, you might be able to get you can get it replaced, but you might lose it. You might also swallow it, which would actually cause a lot of other problems. And so the thing is, yes, while biting may be something that you could consider, you also have to consider the risk associated with it. Everything that can be associated, not just to the attacker, but to yourself. Are you okay with catching whatever disease they have? And yes, I would tell you, when you're dealing with self-defense, you should really be considering what diseases the other person has. If you're okay with potentially having a disease that will end up staying with you for the rest of your life or kill you, well then, that's one thing you could do. If not, you may want to use other options. Now, I always say that there are different things you have to look at. Every individual has to figure it out for themselves. But would a bite really be something that would be worth? Well, first of all, how would you practice biting except for eating? And is it something that you're going to find yourself being able to use easy? And are you willing to do it? Remember, if it's a bar fight, maybe it's not a good idea, which I always think bar fights are never a good idea. If someone's trying to kidnap you, that might be a nice thing to do because you're actually marking the person. You disappear, they have a bite mark on them. It may actually be something that can actually help you in the long term. But you also have to realize that you can lose teeth. You can end up getting any bloodborne pathogen that they have. There's a lot of other things that you can deal with that besides just the, oh, I bit them and they let go. The other thing is, if you have other things in that are available, a lot of times it's better to try those first. I hope this makes sense, and you have a nice day. Take care.